Good morning, respected chairpersons and my colleagues and seniors. Myself, Dr. Dharmendra Kumar from SSKM and IPGMR Hospital, Cardiology PDT, going to present a rare congenital heart disease case. So, we had a 17-year-old female who presented with the complaints of dyspnea on exertion since 3 years and on and off chest pain since 2 years. On examination, her pulse rate was around 100 per minute, normal sinus rhythm, and BP was 110 by 70 mm of HME. On examination, cardiovascular system, S1 was normal, S2 was also normal. There was a pansystolic murmur heard in the apex radiating to axilla of around grade 3 by 6. ECG showed a poor R-wave progression, and there was a QS pattern from lead V1 to V6. On chest X-ray, there was apparent cardiomegaly, and there was none other findings. So we proceeded for the echocardiography. We did the echo, and on parasternal long axis view, there was cardiomegaly of LVIDD of 62 millimeter, and EF was normal, around 63%. So here we can see there was a eccentric MR which was moderate to severe, and contraction was good of EF, I have told, around 63%. And this was the 4-chamber view. Here we can see a multiple collaterals or multiple flow in the interventricular septum, and there was a severe eccentric MR. And we quantified the MR. The MR Vmax was 4.8 meter per second. And this was a parasternal soft axis view, where we can see there is a flow in the right coronary artery which is dilated, which is quite apparent, and also there is a coronary artery which is almost originating from the pulmonary, which is not very well visible over here. Here you can see in the second moving pictures, there is a dilated the right coronary artery. So we proceeded for the angiogram, where we could not find any left coronary artery, we couldn't engage, and we took the shot of the right coronary artery, where we found out right coronary artery was dilated and tortuous, and left system was filling from the right coronary artery collaterals, and it was draining into the pulmonary artery. So we confirmed the diagnosis of anomalous left coronary artery arising from the pulmonary artery, adult type, and with the severe MR. We suggested for the patient to go for the surgery, but as patient was almost around mild to moderate symptomatic, the parents and the patient refused for the surgery.
Yeah, good.
The take-home message: anomalous left coronary artery from pulmonary artery is a rare disease with the incidence of 1 in 3 lakh live births, which accounts for less than 5% of congenital heart disease cases. Usually manifest as an isolated defect, can be associated with other defects in 5% of cases, along with PDA, VSD, or TOF. Al-Kappa results in coronary still phenomena in which left to right central leads to abnormal left ventricular perfusion, resulting in a compromised perfusion to the myocardium. If left untreated, up to 90% of patients succumbs to death within 1 year of life. And in adult type of Al-Kappa, complications is associated with the myocardial ischemia, LV dysfunction, mitral insufficiency, arrhythmia, and sudden cardiac death. Only 10 to 15% patients survive to up to 30 years of life.
Yeah, thank you very much. That was a nice presentation.